My name is Gwen Covey-Crump. I'm a specialist in veterinary anaesthesia and analgesia. You might have seen me before on cam videos and different Facebook things, but I'm going to give you a soundbite today for the big walk. So I was going to talk about polypharmacy, which is something that comes up an awful lot, also known as multimodal pain management when we're talking about drugs. So this is giving several drugs with different actions at the same time to get a desired effect for the patient. The benefits of it is it avoids large doses of any one drug, because obviously, for example, a dog that's on a non-steroidal anti-inflammatory, if it's still in pain, we can't increase the dose of that anti-inflammatory beyond a certain level without causing side effects. So we need to introduce another drug. And sometimes a dog might be on several different medications for pain, and we're using it to target different aspects of the pain. And so it shouldn't be feared, but it should be regularly reviewed, because we shouldn't just be putting dogs on more and more drugs without thinking about each one and whether they're still useful or not. So having your dog on lots of different medications can get really complicated. Timings can be awkward. Which drugs can you give together, and which drugs do you need to separate in time? Do you have to time it around meal times? Will your dog only take medication with food? Time it around waking and bedtime, and including your waking up and bedtime. And does it last through the night? So some drugs have a very short action, and you need to give them at bedtime in order for them to last through the night. And overall, we also need to think about your quality of life, which is why I'm talking about your waking and your bedtime. So I suggest, if you've got your animal on lots of drugs and it's getting a bit complicated, you make an appointment with your veterinary nurse or veterinary surgeon to really discuss and make a plan for the day's routine. Don't assume that all drugs must be given separately. I see a lot of this where people think that every drug has to be given at a separate time, which gets incredibly complicated if the dog's on 3 or more drugs. Consider which can be given together with the nurse or the vet, which can be given with food, which need to be given on an empty stomach, and those which it really doesn't matter. Think about how long the drug lasts. For example, I'm using the example gabapentin. I see a lot of vets prescribing twice a day. It's quite short acting. I recommend prescribing 3 times a day. And then I also recommend that the last dose of the day should be at bedtime. I'm talking 9:30 p.m, 10 p.m. Otherwise, the dog tends to wake up at sort of 3 a.m, a bit uncomfortable, and you get breakthrough pain. And then there are other examples like that, such as paracetamol, which are quite short acting. And then make this daily plan, this routine, write it all out, stick it on your fridge, and then keep a diary of how it's working. Keep a diary of how your dog responds to it. If you have any problems with missed doses, any issues you have with getting the medication into your pet. So there's so much more I could say about this. This is meant to be a super short video. So I think overall, the main thing is to ask for help. Don't assume you've got to battle this through and figure it all out yourself. It can get very complicated. So I hope you enjoyed this soundbite. Bye.